So I'm Julie Beck, and I work in West Haven at the VA, and I joined in September of 2012 as a new nurse practitioner, and my role there is the cancer care coordinator. I also see patients in clinic. I'm an oncology nurse practitioner. So since joining the VA, I've had a number of different responsibilities. My primary responsibility is I'm the lung cancer navigator, but also as part of those responsibilities, I have a survivorship clinic. So I see patients who are early stage lung, colorectal, and melanoma cancer survivors. And as part of that clinic, I undertook a project to create a cancer survivor treatment summary and care plan because this is a new American College of Surgeons standard that is supposed to be in place by 2015. So we just learned recently that we had been operating under the assumption that every cancer survivor needed to have this care plan in place. This, in fact, is going to be phased in over a couple of years, but we undertook to create a template that would be very specific, that would be short, easy for the veteran to read, and that would be in the electronic medical record, and also be provided to the patient in hard copy and to any of his providers, his or her providers. So this was actually a lengthy process because it involved a lot of different people in the facility. I worked with clinical informatics. I worked with our providers, the doctors, to review the language to make sure that we were following NCCN guidelines for follow-up. I did a lot of talking to other people throughout the VA nationwide because there is a survivorship special interest group, and that group was a tremendous resource. And then I basically took all of those pieces and kind of tweaked it and edited it, and over a 6-month process we created this template. So I've created now 65 care plans, but it's really just scratching the surface of the number of cancer survivors we see in West Haven. So we decided we would take the approach of starting with the patients that I see in my clinic, and then expanding this to other patients using the tumor registrar to generate a list to determine who had been diagnosed in the last 5 years. So basically, in the survivorship clinic, I follow patients for 5 years for surveillance, but the goal is that every patient who has been diagnosed and treated in our facility would have this care plan. So I guess the key elements that we tried to put in place for the care plan is to keep it really simple. We made sure that the language had been approved by our hospital education person, and that she felt that it was appropriate at appropriate level in terms of readability for the veteran. Something that we tried to do was to make sure that we had checked throughout the electronic medical record, but then separately checked with the veteran to make sure we captured any side effects he or she might have had during their treatment. So it's somewhat of a lengthy process because first you're checking through the chart and then you actually verify everything independently with the individual. But we've had great response from the patients. Included in this very short document is a list of kind of signs and symptoms for them to report, and they find that very helpful. So I think it relieves anxiety because a lot of times they have a fear when they aren't having any symptoms. You know, what might this mean? Is my cancer coming back? So having that very specific list that is disease specific is very helpful to them. We also outline what the follow-up plan will be as far as clinic visits, lab work, and imaging, and by disease type. So that was basically the project. I think there was a lot of interest in the group about how to implement this. I think throughout the VA system, it's challenging because some facilities have more resources. You know, the patient populations vary, and all of the sites are really struggling with how to put this in place. Who should create the care plan? What kind of format should they use? When should it be given to the patient? What disease types should be the priority? So right now, the patients I see in my clinic are early stage lung, so stage 1 lung cancer, early stage colorectal, so that's stage 1 and 2 colorectal, and early stage melanoma. I do see other patients who don't fit those criteria, but that's the main focus because those patients are generally less complicated. They haven't had chemotherapy. They've generally had either radiation or surgery. And I initially wasn't sure that this would be a tremendously interesting clinic. I thought it might not be. But what I found out as I started to follow patients who are just coming off of having been treated for an early stage cancer is you have a tremendous opportunity because you're catching them really at a teachable moment where many of them have not really taken stock of kind of their health behaviors, and they view it as kind of a second chance. So I also find that patients sometimes have residual effects from their surgery or their radiation treatment that for whatever reason are getting lost and not really being followed up on because there's a gap before their next primary care appointment, and I see them every 3 months. So it really provides a safety net. So after surgery, if a patient comes into me and says, you know, my breathing really isn't good, and I say to them, well, what was it like before surgery? And then there's a big difference, then I know to follow up and get them plugged into pulmonary rehab or to be seen by a pulmonary provider or sometimes a cardiologist. So it really has been very gratifying because in many cases you can make a big difference with these patients. You can address a symptom really early on, and it's reassuring to them to know that their quality of life is not forever changed by this diagnosis. It can actually be improved. So, and then there's a lot of teaching as far as healthy living, making sure that they are all up to date with every other kind of vaccine or surveillance for other types of cancers, screening. So I hope it's a model that can be shared, and I've actually provided the information on how I did it to many other sites because, as I said, there's a lot of people are feeling pressure to get a program in place, and it actually took me 6 to 9 months to get my template done, and I was starting with a pretty formed template. But the process, at least at our VA, we have a forms committee that reviews anything that's going to become a new template in CPRS, which is important. It needs to be in place, but it required 4 visits actually to the forms committee to get this 3-page document approved. And so I think just spelling that out for everybody was helpful because it gave them a timeline. So that being said, a number of people have asked for my template. Sites are varying in terms of who they're expecting to do the template. So some sites are looking to tumor registrars to generate the template using information from the tumor registry. Some sites do have a nurse navigator. Some sites are using oncology physicians. It's a huge amount of work to do this for as many patients as needed. So I think that's a little bit of a struggle for every facility to determine who is the person who's going to be doing it.